Hi, I'm Rosana Salvaterra, and I'm the Medical Officer of Health in Peterborough. Well, it's a role that's very well described in our provincial public health legislation, the Health Protection Promotion Act. Essentially, I am accountable to both the Minister of Health and to our local Board of Health to ensure the delivery of all of our public health programs and services, but really to ensure the health and well-being of our communities. I was Associate Medical Officer of Health in Toronto, and I was Director of Planning and Policy. But I was really looking for a place where I could practice not only urban public health, but rural public health, and especially Indigenous public health. And at the time, Peterborough was the only Board of Health in the whole province that had two First Nations fully engaged at the governance level on the Board of Health. And that, I must say, was the real draw for me and the reason why I left Toronto and came here. Well, I must say too, when I came to Peterborough for my initial interview with the Board of Health, the mayor of Peterborough was on the board, which to me signaled how important public health was to this community, because I hadn't seen that before in my other experiences. But then also Chief Keith Knott, who was the chief of Curve Lake at the time and also on the Board of Health, gave me this big hug. And I thought, yeah, this is a great board. This is a great opportunity. In many ways, it was a dream come true for me to come here. So in many ways, it's hard to compare and contrast Peterborough with either Stratford or with Toronto. I must say the role is essentially the same in many ways, but the dynamics are so different. I think probably the biggest difference is that whereas working in Toronto, given its population and its size and its complexity, was sort of like being the captain on the Queen Mary, being in Peterborough is more like a sailboat. We can be very nimble. We can, change quickly. We can pivot. We know our partners. We have strong relationships. There's a level of trust there that makes decisions pretty quick. You can gauge when you have consensus and when you don't. But on the other hand, I think the big difference, certainly between Peterborough and Toronto, and something we shared with smaller boards of health, is the scarcity of resources. We're constantly trying to rub two nickels together to make a dime. We are often faced with trying to respond to issues where we don't have enough staffing, so we have to turn to the community and we have to pool our resources, or we have to count very heavily on volunteers. And thank goodness Peterborough has an abundance of community-minded volunteers that we often have to call upon. Well, I think we had an early glimpse of what might be coming, and that it might be a train headed down the track towards us. I mean, I had certainly been following the emails, and we have an international network that shares information, and there was something there, the last day of December about an outbreak of severe respiratory illness in China, unknown etiology. But here in Peterborough, we called together our Peterborough Pandemic Response Task Force or team early in January. And we gave them a heads up to say, hey, be aware, Something's happening in China. We're not sure whether it's going to impact us here, but it's time to dust off your pandemic plans. Make sure you have a business continuity plan. And so I would say that here in Peterborough, we were on this really from the start, and that we, rang the alarm bells quite early to get everybody ready. Well, I would say that it's meant that, well, it's not for the faint-hearted, and certainly being part of this pandemic response has meant that you've got to be up for the challenges of moving at a very fast pace, being able to deal with the unpredictable, and really tolerating what that does to your own self and your own life. It's been a big challenge, not only for me, but for everyone I work with. And in many ways, it reminded me of my time as a physician providing obstetrical care to my patients. In that, it was, you had to be comfortable with making decisions quickly, often with not all of the information. So you had to, be thinking ahead, make decisions. Sometimes you're the only calm one in the room. And by no means are you the star of the show, It's the mother. In the case of obstetrics, it's the woman who has given birth, and it's that new life, that new baby. And as well, I think here with this pandemic response in Peterborough, all these months, there are so many heroes and so many champions, and I just hope that we have an opportunity to acknowledge and recognize all of these efforts and the sacrifices that people have made these last 18, 19, 20 months. The other analogy that I'll share, and I've said this, I've shared this in other settings, is that it really has been, we've been flying this plane as we build it. And that is really, when I think of how often we've had to pivot and how often things have changed, sometimes over a number of hours, there's been nothing like it in my life. I think the biggest lesson for me personally, and I think as a society, I hope, is that we've all had to become much more tolerant and more patient. We all wish that this thing was going to be over in 6 weeks and we could get back to our lives. And that hasn't been the case. We've had to defer and postpone and rethink everything. And we've been forced to live in the moment, almost like getting a cancer diagnosis, where you have to give up all your future plans and just deal with the realities of every day. Well, we've been doing that for the last year and a half. So I think it's really taught us to be patient. And I think that's a really important lesson for all of us to learn. So the challenges come for the healthcare system. Well, I think first of all, we have a lot of catch up we need to do. And whether it's hospitals with their elective or, surgeries, or whether it's public health with the immunization of children and school pupils, or even, things like oral health exams. We're in the schools each year assessing children for dental decay and getting them care that they need in order to protect their oral health. We haven't been able to do that. We haven't been able to focus on healthy public policy and those long-term kinds of strategic things. And, it's going to be so good to get back to that, but we do have a lot of catching up to do. And some things have been changed and won't be the same. So in a way, you know, we're going to have to build back, but build back better and differently. I think the other thing that's going to be different is that we're going to, I think we've gained a bit of comfort with working virtually, one that wasn't there before. I can remember when teleconferencing into meetings was a big deal. Well, now, you know, hopefully we're all a lot more comfortable with working virtually and deciding, you know, when do I need to do this in person? When do I need to assess this patient in person? When do I need to have this meeting in person? And when can I do it virtually? So I'm hoping that we will have gained some efficiencies and some new tricks that we can bring to our work going forward. But then I think there are also some structural issues we need to address. And I think everyone knows that when it comes to long-term care and the care of the elderly and the fragile and vulnerable, that we need to do a better job, that we need to address the systemic issues like the infrastructure, but also the staffing, you know, and I'm glad to see that this province has invested more in training up more personal support workers, and that they're being paid better. And I hope that continues, that we recognize that essential workers, whether they're in long-term care or whether they're delivering your hamburger, that they need to be valued, they need to be compensated, they need those benefits that allow them to work but also have a life. So I really hope we hang on to those coming out of this pandemic. Well, certainly COVID has tested my own personal stamina and resilience. So I'm proud of the fact that I've survived. I need a t-shirt that says, you know, survived COVID, and proud of it. I think looking back at my public health career, though, I would think it's the work that I've been able to contribute to at the provincial level to really embed health equity into the work of public health, to articulate what that means for boards of health and local health organizations. That's probably the work I'll be most proud of, as well as my own personal growth in my understanding and knowledge of the Indigenous perspective, both that are historically in this country, as well as what it means here for us living as a community, and being able to really add to that for public health as a sector, being able to contribute to that. That's probably what I'm most proud of. Well, I have been reminded of Gordon Lightfoot's song, Alberta Bound, which I learned as a teenager, and now I've been humming because we are planning to move to Edmonton hopefully by the end of September, if all goes well and a successor can be brought on here. And I have a daughter and a family of grandchildren there that I hope to be able to enjoy in the next few years. So that's my most imminent plans, would be getting a good dose of that family out in Alberta. Well, if it isn't obvious, let me say that I will miss Peterborough. You know, I will miss the amazing people I've had a chance to work with, the past and present staff at Peterborough Public Health. They are so dedicated. I really am in awe of many of those people I have had a chance to work with. Very grateful. Also very grateful to the boards of health, past and present, to their dedication, to their vision. I'm very grateful to the friends I have acquired while here in Peterborough, this great community, the elders, the mentors. I'm grateful to my own faith community, the Unitarians. They've been a tremendous support and a real gift to me these past 13 years. So a big part of my heart is going to stay in Peterborough. I feel very torn leaving. It's going to be hard for me to do. And I'm going to tell you now, there will be tears. So it is a difficult thing, but it's time. In many ways, it's time. And I wish only the best for Peterborough Public Health and for the community of Peterborough, for Ngojuanong here, and all the wonderful parts of it. You know, it's been a real privilege and a real honor.